hand sanitizer. I started it. Okay, hi, my name is Jasmine. I'm
Hi.
going to do your wellness exam
Okay.
today. So your head is normocephalic, your hair is evenly distributed, there are no signs of lesions or trauma. I'm going to palpate your head. Do you feel any pain or tenderness?
No.
Okay, so I'm going to check your cranial nerve 7 facial, and I'm going to have you raise your eyebrows, close your eyes really tight, and then smile for me. Okay, so cranial nerve 7's intact. So I'm going to check your trigeminal nerve. So let me know when you feel these cotton balls.
Yes. Yes. Yes.
Okay, so cranial nerve 5 trigeminal sensory is intact. And then now I'm going to have you clench your teeth really hard real quick. All right, cranial nerve 5 trigeminal motor is intact. And then I'm going to palpate right here. Can you open your jaw for me? Okay, do you feel any pain or tenderness with that?
No.
Okay, so no pain or tenderness, no clicking, and then the jaw opens symmetrically and evenly. So from here, I'm going to have you, I'm going to hand you this. So looking at your neck for your thyroid, there's no visible masses, nodules, or goiters present. So I'm going to come behind you, and I'll be putting a little pressure on your throat, and then I'll have you swallow a little bit of water. Okay, so during that, I did not palpate any masses or nodules or goiters of the thyroid, and it moved up and down with swallowing. So from here, we're gonna go ahead and do your eyes. So just visually looking at the eyes, there are no signs of redness, there's no signs of drainage or crusting on the eyelashes, your sclera are pink, your conjunctiva are white, and then your eyes are symmetrical. And we'll go ahead and move on to the rest. So I'm gonna give you the Snellen eye chart. You're gonna hold it at arm's length away, and I'll have you read this bottom line for me.
LTFPH.
Okay, and then I'll have you cover one eye for me, either one's fine.
LTFPH.
And then if you will switch for me.
LTFPH.
Okay, so patient's visual acuity is intact. Might be wearing corrective lenses, but might not. No,
Not.
she's not. Okay, so I'm gonna dim the lights really quick. Okay, so I'm gonna shine this light into your eyes. If you'll just look straight at my nose. Do the other side. Okay, so direct pupillary constriction is intact, and then I'll have you look at my nose one more time. Now I'm looking at the opposite pupil. And then consensual pupillary constriction is intact, so cranial nerve 2, the afferent limb is intact, and cranial nerve 3, the efferent limb is intact. I'm going to turn these back on. You don't have to have it dark the whole time. Okay, so I'm going to check your eye movements. So if you'll follow the tip of my pen light for me. Okay, so cranial nerves 3, 4, and 6 are intact. I also didn't say this, there is no ptosis or eye drooping and no nystagmus noted during any of this so far. So now I'm going to test for your optic nerve on cranial nerve 2. So if you will cover your right eye, and then I'm going to, let me know when you can see my fingers.
Yes. 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 Yes.
Okay, and we'll switch eyes.
Yes. 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 Yes.
Okay, so cranial nerve 2 is intact and her peripheral vision is good. So next we're going to check accommodation. So I'll have you stare way off over there at the wall. So her pupils dilate with distance vision. And then I'm going to have you look at the tip of the pen light. And then her eyes accommodate and move in. So cranial nerve 6 is intact. I don't think that's right. Anywho, yeah, I think that's it there. We're going to move on to your nose. And then so I'm going to palpate your nose. Do you have any pain or tenderness?
No.
Okay. Check your maxillary sinuses. Frontal sinuses. Any pain or tenderness?
No.
Okay, so the bridge of the nose is intact. There is no visual signs of deformities or deviations. I'm going to go ahead and have you close one sniff for me. And then do that on the other side. Okay, so my nares are patent, or Courtney's nares are patent. Okay, so if you'll do that one more time on one nostril, and then I'll have you smell this, and then tell me what you smell.
Lemon.
Okay, do the other side.
Eucalyptus.
Okay, so cranial nerve 1 olfactory is intact. So I The green.
but I don't know. That's just what I've seen my other practitioners do.
There. Okay. I'd make sure it works first, you know. So I'm gonna have you tip your chin up just a little bit. Alright, so nasal mucosa are pink and moist. There's no drainage, and then her nasal term bits are intact. Okay, so I'm gonna check your lymph nodes. Can you drop your head for me just a little bit? So this is the occipital, and then here's your posterior cervical chain. Post-auricular, can you put your head up for me? Pre-auricular, tonsillar, submandibular, submental, and then the superficial and deep anterior cervical chain. So if you'll now shrug your shoulders kind of up for me. Supraclavicular, infraclavicular. Okay, so lymph nodes, did you feel any pain or tenderness with that?
No.
Okay, lymph nodes are non-palpable, they are soft, did not feel any abnormalities with that or any overly large lymph nodes. Okay, so next I'm gonna go ahead and look at your ears. So just do my visual assessment. There's no trauma, redness, drainage, erythema, and I'm gonna palpate your pinna and your trachea bilaterally. Same on this side, no redness, drainage, erythema, no lesions or signs of trauma. And then I'll do the same thing by shining the light. I can never get it to act right. Okay, same thing, no redness, drainage, erythema. Same thing on this side. Okay, and then now we will look inside your ears at the internal ear canal. I'm going to pull your pinna up and back. Okay, so we'll do the same on the other side. Not to get your hair, pull your pinna up and back. Okay, so her tympanic membranes are pearly gray. There's no fogginess, no redness, no swelling that looks like it's about to rupture. And then there is the cone of light in the right ear at 5 o'clock and the left ear at 7 o'clock. I'm missing one more thing. Stupid. Okay, I'm gonna look at your mouth. So her lips are pink, moist, and intact. There's no signs of trauma or any lesions present. So I'll have you open your mouth for me. So her teeth are all intact. Her dentition looks good. Her tongue is moist and pink. Can you stick your tongue out for me? And then can you move it side to side? So cranial nerve 12 hypoglossal is intact. And then can you stick your tongue out for me one more time? And then say ah. Okay, so her soft palate and uvula both rose in symmetrically, and there was no deviation off to one side. And there was no tonsillar exudate, no redness, no erythema, no lesions or anything concerning. So I'm gonna have you drink some water real quick for me, one more time.
It's okay, I'm thirsty.
Okay, did you have any difficulties swallowing?
No.
Okay, so cranial nerve 10 is intact, and then one more check. Can you count to 5 for me?
1, 2, 3, 4, 5.
Okay, and then there's another check for cranial nerves 9 and 10. Hypoglossal and vagus are intact. I did miss one check. So I'm gonna have you cover this tragus on this side really quick. And then I'm gonna say something behind you on this other side.
Apple bottom jeans.
Okay, can you cover the other ear for me?
Boots with the fur.
Okay, so cranial nerve 8, vestibular cochlear is intact. Done all that. Okay, I guess we're good to move on to respiratory. So looking at her, there's no signs of distress throughout this assessment. She's breathing comfortably with a regular rate and rhythm.
Sorry.
So I'm gonna start off and palpate your chest really quick. And then while I'm doing it, I'm kind of checking for crepitus too as we go. Check under your arms really quick, under sides. Go on your back side super quick. Move the hair. Do you feel any tenderness or pain as I'm doing this?
No.
Okay, so I'm gonna start with percussion on the back since we're here. Okay, come back around and do it on the front. your arms for me one more time. Sorry, kind of push you. Okay, so percussion is resonant and there's no hyperresonance noted, and it doesn't sound like there's dullness either, that there's any fluid. So next, I'm just gonna go ahead and listen to you. So every time you feel my stethoscope, if you'll just take a deep breath in, and then let me know if I'm going too fast and if you get dizzy. Okay, can I have you raise your arm? And try, can you lift your wrist for me on this side? Come under this arm. Okay, I'm gonna go to the back. Good job. Okay, so their breath sounds are clear bilaterally, no rhonchi, crackles, or wheezes. Her chest expansion has been, her AP diameter is 1 to 2 throughout this assessment as well. So I will check your chest expansion. I'm gonna have you lean up one more time for me. I'm gonna put my thumbs about the 10th rib. Now if you'll breathe in deep for me, and breathe out. So my thumbs moved apart 2 to 3 centimeters, and I'm gonna check tactile firmness. So every time my hands touch your back, say blue moon for me.
Okay. Blue moon, blue moon, blue moon, blue moon.
Okay, so normal vibrations, there is no hyper vibrations or low vibrations noted. And then her color throughout has been pink, and she's not gotten cyanotic, so she tolerated the respiratory assessment well. So we're gonna move on to cardiac, so same thing. I'm gonna start off just looking at her appearance. There are no heaves and lifts noted. She does not appear to be in any distress. I'm going to palpate over your heart, and I don't feel any heaves at this time. So I'm now going to just palpate your valve location, so aortic, pulmonic, Erb's point, thank you, tricuspid, and then mitral, and then I'm gonna go ahead and percuss on here, mitral, tricuspid, Erb's point, pulmonic, aortic, okay, and then everything there seems good. So I'm going to listen now to your valves again with the diaphragm of the stethoscope and the bell. Erb's point. Feel the empty breaths for you one more time. Tricuspid. Mitral. Flip it to the bell. Mitral. Tricuspid. Erb's point. Pulmonic. Aortic. Okay. So S1, S2, she does not have any irregular rate and rhythm. It was pretty regular for me, and I did not notice any murmurs. So next, I'm gonna listen to your aortic again. I'm gonna have you lean forward a little bit. You'll take a breath in, exhale, and then hold whenever you feel my stethoscope. And we'll do this with the bell. Okay. So no aortic stenosis and no murmurs noted. So I'm gonna do the same thing and have you lay on your left side. Hold your bed steady. Please do. Okay, so we're gonna do the same thing for your mitral. So if you'll take another deep breath, exhale. Okay, so same with the mitral for the aortic. S1, S2 noted, but no murmurs. I'm gonna have you try and lay back for me. Your badge is going. There we go. Okay. So ideally we would have them sitting 30 to 45 degrees up, but we're working on a budget. So I'm gonna have you turn your head to the right for me, and then turn to the left for me. So no jugular venous distension noted. Her pressures look good. And then I'm gonna have you sit back up real quick if you can. Okay, so I'm gonna take a look at your carotids real quick. I'm gonna palpate them. Do you have any pain or tenderness with that?
No.
Okay, perfect. And then I'm gonna listen to them with the bell of my stethoscope. Okay, and then I did not notice any bruise or thrills. Whenever I was thrills for palpating, bruise when listening. Okay, so next, can I look at your hands for it real quick? So her color is warm. Her color is pink. Her temperature is warm, and her hair is evenly distributed. Her nails are intact. Her cap refill is less than 2 seconds. Can I have you do this for me? So she has a normal nail angle, no clubbing noted. So I'm gonna look at your feet real quick and your legs. Oh, I missed your.
I didn't do that, sorry. I was just looking at my hands because I wanted to.
Okay, so radial pulses are 2+. Brachial 2+. So we're gonna check your legs for the same thing, your pulses, your skin color, and all the things. So in a real scenario, we lift all this out of the way or have her wear shorts, but her popliteal pulse is 2+. And we have her shoes off. Posterior tibialis bilaterally is 2+, and then her dorsalis pedis is 2+. And then we could check cap refill, less than 2 seconds, which we would do on the toes. Her hair is normally distributed, her legs are pink and warm, and then there's no signs of varicosities or any ulcers or lesions or trauma.